Welcome back to Talk Jamaica here on Talk Jamaica Radio. My name is Sanjay Lewis.
And my name is Ralston Chamberlain. The Ministry of Health is once again in the spotlight. The Health Ministry confirmed the deaths of 4 infants as a result of sepsis, a potentially deadly condition that occurs when certain bacteria, fungi, or parasites attack critical organs in newborns. The Chief Medical Officer, Dr. Winston Delahaye, says the infection was due to an organism in the vaginal tracts of their mothers.
Meanwhile, opposition spokesman on health, Horace Daly, says the minister must give full disclosure on the matter. Well, to tell us more, we are joined by the Minister of Health himself, Dr. Christopher Tufton. Dr. Tufton, good afternoon and welcome.
Hi, hi. Good afternoon. I must take issue with your preamble there because I don't think it's absolutely correct, but we can elaborate a little in the discussion. But I'm happy to.
All right, so let's delve right into it then. Just give us an update on this deal.
Well, I mean, the committee which I appointed, which included persons linked to the ministry, but also consultations were held with persons external to the ministry, experts, did most of the talking at the recent press briefing we had. There's a report that was made public. It's been released to the media houses. It's actually on the social media sites, on my Facebook page in its entirety, and I intend to table it in Parliament. Clearly outlines what the issues were as they saw it. There was a spike in death linked to that particular condition. Appropriate action was taken when it was determined that there was a spike, meaning there's an average of a death per month on average. And in this instance, we had 4 deaths in one month, in the month of September. Appropriate action was taken to determine that the condition was confined to the mother-to-child transmission. The particular bacteria does not just lodge in one part. As a matter of fact, what the experts have said, and I've always attempted to yield to the experts because I'm not a medical mind or trained mind. I have my PhD is in business. They've said that that particular bacteria is lodged in most of us, not just women. And it's normally in the intestine, in the anal tract, and in the case of women, of course, it could be lodged in their delivery passage. And in this case, they have concluded that that may have been the result of the cause of the mother-to-child transmission. So it's unfair and unfortunate for those who use this particular situation and the expert advice and conclusion on the matter to give an impression that one was blaming mothers. Nobody at all. Certainly, I didn't hear any of the experts say that. I certainly have not done it. The TMO has not done it. But that impression has been given. But, unfortunately, it's the way that the political mind thinks, and there's an attempt at exploiting a situation. What I can say is that we're happy to have passed the worst. Things are back to normal. The Victoria Jubilee Hospital, when you look at the mortality rate of over an extended period of time, does not show any unusual occurrence, except in the case of this particular incident and this particular condition. And my reports are that things are back to where they were because of the action that was taken, which is good news.
Tell us if you could, Dr. Tufton, how many babies died? Because we hear 7 at one point and we hear 4. And also, can you assure us that we will get information in terms of situations like these so that the media doesn't go searching for the information and then it's distorted?
Well, again, the report is available online and otherwise, so the report is very clear. It indicated that over a 3-month period, 8 babies were infected or affected. 4 were treated and recovered, and we're happy for that. and 4 unfortunately died. That is what is contained in the report based on all the investigations that have been done, the lab reports, etc., etc. So anybody who uses any figure beyond the 4 clearly would be misleading the public unless they have additional information, which I certainly don't have. I have to depend on the experts to give me the information. And if they carry that information and put it forward and it is proven to be true, then clearly we'll have to take another course of action. But as of now, it's 4 infants who were affected, unfortunately.
Mhm. Could you, Dr. Tufton, give us an update on the issue of um, Zika in terms of where we are at?
Well, ZIGB continues to be a challenge for us, but I think we're doing the best we can under the circumstances. We have had a number of confirmed lab cases, multiples of that unconfirmed, but persons who have shown symptoms, the rash and the fever and so on. We have seen its effect in terms of persons who have had to deal with Guillain-Barré syndrome, GBS. We have had just over 100 of those. Those have been treated. We have had a few persons dying. The last report I saw was 2 or 3 or something like that. I don't quote me on it, but it was a relatively low number, unfortunate as it is. In terms of microcephaly, the report suggests up to the 12th of October that we have had no pregnant women delivering babies suffering from microcephaly that's linked to disease. Again, the press conference was quite informative in that it explained microcephaly, what it is, what our track record of that condition is in Jamaica. On average, we have, according to the report, between 8 and 16 cases of severe microcephaly. This is where the child's head is abnormally small and it impacts the development of the brain and by extension the child's maturity and condition. Those persons normally require medical treatment, and on average, based on a range of conditions, not the alone, we've had between 8 and 16 a year. This year we've had 3, and none of those 3 up to the 12th of October are confirmed to be linked in any way to Zika. We have a database of pregnant women who have displayed symptoms of Zika. I think it's close to 600 women, pregnant mothers. The first case was discovered in January, and so you would not see the possibility of severe microcephaly beyond until after September, when the 9-month cycle of pregnancy expires.
Mm-hmm.
So what we have done, we are tracking, we have a registry. In fact, we have a registry in all the hospitals where the circumference, the size of the head is measured, etc., to determine if any of those mothers, or any other for that matter, are born with that particular condition. We have put a 50 million Jamaican dollars fund in place to treat with the condition. We have done training and established an expert team to deal with cases. But to date, none of those cases are confirmed. But it's a daily occurrence, so we'll have to update as we go along. But none to date. And again, there's been a lot of mischief created by those who feel there's an advantage so to do, suggesting that there are multiple cases of microcephaly. I am not a medical mind. I go by the integrity of the medical profession that work in the public system. And the report indicates conclusively that up to the 12th, there have been no case of microcephaly linked to the Zika virus.
Mm-hmm. Dr. Tufton, Minister of Health, I want you to respond, if you could, to the report by the Office of the Public Defender in regards to the 19 babies. And that report said that no evidence of medical negligence, there was no outbreak, and nothing unusual transpired. How do you respond to that?
I have no response to it. The public defender has made his ruling, and he is well within his right so to do. I mean, when these things occur, an investigation is important, as I have done. and that investigation has taken place. Um, and what we have to do is to live by the recommendations and always strive to improve the process. And that's my position. So there's not much more to say on that. We regret that any lives are lost in these circumstances. I certainly do. I think there are some differences in terms of the previous case to this case. I prefer not to elaborate on those differences. I think I have certainly learned from these cases, both the one that took place before my time and the one during my time, and believe that that's how the process should work. You learn as you go along, you improve as you go along, and you make it better for the mothers in this case, the patients in the hospital system that you have to deal with, and the system hopefully is improved. That would be the extent to my comment on the matter.
But let me come back, if I could, Dr. Tufton, because in that same report, the public defender, Mrs. Harleen Harrison Henry, stated that the issue was handicapped by a shortage of resources. Would you agree with that?
Well, I can't comment on that specific case as it relates to resources. What I will do in more general terms is say that the health system is woefully underfunded. The stats on GDP allocation to public health based on benchmarking international standards suggest that you should spend approximately 6% or thereabouts. This is according to the World Health Organization and FAO. We are spending just over 3%, 3.3%. In the meantime, too, that spend, I think, is not as efficiently done as it could be, largely because we have not engaged in a major review and reform of how we administer health, public health that is, because we have not factored in recent times, in a long time, 20 plus years, where the population has shifted to. So in terms of the physical infrastructure, the hospitals, the clinics, where they are located, the regional health authorities and the efficiency of those authorities, which should have been reviewed many years ago. So there are a host of issues which have to be confronted, which I believe requires assessment and firstly to get more efficiency and better spend for the money that we currently allocate. But ultimately, I believe to get more allocation. So if the situation is as I have suggested, then clearly you're going to have areas of concern and challenges which are going to be linked to resources. But it's not always resources.
I want, as we speak of resources, Dr. Tufton, I want to come back to an issue that appeared in 2015 when you were co-director of CAPRI, and you're quoted as saying it appears the non-user fee policy was not sufficiently supported by adequate assessment nor enough provided to support the expected increase in use in the public health facilities when it was introduced. And the report went on to say it was based on the party's promise in a lead up to the election. Do you still have that opinion? And now, as Minister of Health, are you looking at this whole issue of the non-user fee?
Well, first of all, the CAPRI report is not my report. It's a report of research that was done, and in this case, it was a survey.
I'm quoting you in that report, though.
Of public opinion. No, well, I don't think you could quote me in the report. It's probably quote the editorial, or anyway, it's not my report. But having said that, I'm very clear on what my position is. The idea of universal access to health is very important. You cannot deny persons based on their ability to pay. And there's no doubt that in the past that has happened before free healthcare was announced. And I think it is a problem because otherwise, to me, it's almost a human right for persons to have access to medical care. The quality of that care is a function of expenditure. And in a country like Jamaica, where we have not seen growth for a long time, or adequate growth, we have suffered because of limited or less than adequate resources being allocated. You cannot go back to a situation where persons are just asked in a generalized way to pay, knowing fully well that there are many persons who cannot afford it. So the question is, how do you guarantee access, but at the same time improve the quality of access? And this is why the administration of which I'm a part has spoken to the need, for example, for a national health insurance scheme. This is why we're pushing public-private partnerships. This is why we are very big on the need to define a greater role for charities. There are many charitable entities that have given a lot to healthcare and many more that could give even more. So this is all captured in the need for a reforming of the process, which is what we're doing. We've commissioned a 10-year strategic plan committee, which is now actively working, which is going to review all of these. We have a committee working on the National Health Insurance Scheme, lodged in the National Health Fund, chaired by Mr. Christopher Zaka. All of these are aimed to basically enhance the allocation, sometimes through some sort of group scheme like insurance, in other cases through budgetary allocation, in other cases through more efficient allocation, but at the same time recognizing the absolute and fundamental need to ensure that those who cannot afford it will have universal access, and that's not negotiable.
Mm-hmm. Dr. Tufton, your opposition counterpart, Horace Daly, he was on a show on this very station last week, and he made mention that the communication from the ministry is not strong. We're not hearing enough from you, and he says all he's hearing or seeing is tweets. How do you respond to Mr. Daly?
Well, it's unfortunate that he doesn't appreciate the multimodal approach to communicating. I have no difficulty with tweets. I think social media is a fundamental part of communicating to your audience. Having said that, we have, I think, been most visible, meaning the health ministry, in recent months as it relates to Zika. I don't think you can turn on your TV and not get a message about personal responsibility and mosquito breeding sites and so on. We have done the same in the print media. We are on billboards. Some have accused us of being too visible. I've seen that written also. So I think he has a misunderstanding of what we're trying to do, or perhaps it suits him to say that. The truth of the matter is that healthcare requires communication. There's no doubt. I agree with him on that. There are various means to communicate, and for him to suggest that social media is not one of those ways to communicate is to insult the thousands, hundreds of thousands, and indeed millions of Jamaicans and others who have kept in touch with current events, issues through social media, and that would be most unfortunate. I hope he didn't mean that. I am also available to him, by the way. We sit in Parliament every week. We converse when it's necessary. And I have never, ever said that I am unwilling to give the opposition information. So whenever they are ready, I am available. And indeed, I have been prepared to volunteer that information to them also.
He also said that he spoke to you, Minister, on some Zika workers who are yet to be paid, and he said that you promised to investigate the matter.
Well, I'm not sure about that, because as far as I know, all Zika workers, these are the temporary workers now. We had over 1,000 volunteer, well, not volunteer, but temporary workers. As far as I know, they have been paid. In the early stages, there were some misunderstandings because we had to shift the agency administering the payment from the parish council to the Ministry of Local Government. And it did create a delay for a few weeks. But as far as I know, again, that is certainly back on track and is taking place. So, again, we don't need to make a mountain out of a molehill. We will have hiccups now and then, but we correct when we identify them and we move forward.
Dr. Tufton, earlier in this discussion, you said that it's unfair and unfortunate that persons with political minds would look at use this issue of the babies that died recently to gain political points or looking for a particular situation to blame. If my producers can find the clip, I want to play a clip for you and then I'll come back and ask you a question. So, all right. So they're having problems finding the clip. But the essence of the clip, Dr. Tufton, was on a political platform. Then leader of the opposition, now Prime Minister, stated that he could hear the dead babies crying. He could hear them saying that if the JLP was in power, they would not have died. And given the report that came out from the Office of the Public Defender, in retrospect, would you agree with me that it was an unfortunate statement to have been made then by the leader of the opposition?
So first of all, the leader of the opposition had to use the information that was available to him at that point in
Yeah,
time. And let me explain to you the difference since you have gone there. Why there's a qualitative distinction between what took place then and what has taken place now. You never heard me say or try to define when a fetus is alive or when it is not alive, when a baby is a baby or when not a baby. And that to me, that to me was unfortunate. And I think the opposition was well within its right when, let me finish please, when the then minister sought to make that kind of distinction when he sought to explain the situation. We have been, the issue related to the previous situation, and I say this with the utmost respect for the mothers and all who have been involved, and I'm actually trying to be very constructive about it. In this case, this issue has been a mother-to-child transmission, and it's unfortunate, and we regret it, and we have to do more, all of us in the health system,
right.
to ensure that people are aware, mothers are aware about what needs to be done, tests are done to deal with the situation. In the previous case, it was an issue related to the sanitary facilities and some of the issues there. Having said that, the public defender has said nobody is to be blamed, and I will accept that because the situation is challenging, and the health workers have to operate under very challenging situations at times. But there is a distinction. It was not the same condition. It's a different condition. And frankly speaking, the leader of the opposition at the time had to go based on the information he had. And the information he had was limited. It was being given out in a way that seems to have been as if there was a sort of reluctance to provide the information. And then on top of all of that, there seems to have been an attempt to determine that these babies or these individuals that were affected were not really, living beings. And that to me was most inappropriate and deserved condemnation and certainly criticism at that point in time.
And I agree with you absolutely on that,
said all
Dr.
of that,
Tufton.
having said all of that, I think we have to learn from these experiences. I have to learn. This country has to learn. The opposition has to learn. And I don't think it serves anybody's interest to make heavy weather and to compare and to contrast. What we have to do is identify where we went wrong, what needs to be done, and how we need to improve going forward.
Let me then speak to the issue, Dr. Tufton, of the whole idea of public education in terms of the ZICV. And I know the ministry has been on a campaign to ensure that persons are taking on the message of public education and now to keep their environment clean. So we recently had some rains in regards to the expectation of the hurricane. Are you getting any feedback from those who are out there in the field that things are improving?
Well, you're not going to get rid of the mosquito in an environment where individual action does not seek to destroy mosquito breeding sites whenever it rains. The Aedes aegypti mosquito is here and will be here for a long time. So in a sense, it literally has to be to try to encourage and change the mindset and the behavior of Jamaicans, which is why the public education program was targeted at individual action and why it is important for people to act in their own environment. We have had some rains recently, as you know, and as a consequence, I suspect breeding sites are going to be right back where they were. It means that the fogging has to continue, but that is a very temporary measure. But more importantly, it means that the citizens have to take appropriate action. Now, the thing with Zika is that because it is a new virus, it is going to impact the entire country. And it has been. Once it travels across the country and impacts a number of citizens, over time, the natural immune system will develop some resistance towards it. With time, hopefully, there will be a vaccine. I know there are trials taking place now. And that vaccine will minimize the risk if persons were to take that vaccine, just as they do the flu shots or any other of the viruses that are out there. So this virus, because it is new, makes us particularly vulnerable. But over time, that vulnerability will elapse once we get into a particular mode. But we can't be complacent. It's important to know. Because other viruses are going to come. It's almost inevitable that you're going to face other viruses. So the focus has to be to deal with breeding sites, deal with the breeding of these mosquitoes in particular, the Aedes aegypti. And that's why over time we are looking as a policy at developing a more focused attention on the elimination of the Aedes aegypti. But you'll hear more about that in the months to come.
And as it relates to the going forward, Dr. Tufton, hearing more from the ministry, can we expect to, hear you more, have you more often on this program?
Well, listen, sometimes I think I'm overexposed because you hear me so much. While some people are accusing me of not saying enough, others are accusing me of being a marketer and being too visible. Well, you can't please everybody. You just have to do what you have to do. I will do what I think is necessary because I'm not driven by I'm driven by the greater good, put it that way. Right. Whatever I think is in the best interest of the country, that's how I will act, how I will operate. So the answer to your question is yes, you will hear more of and from me, and it will be all geared towards educating people. Remember one thing before you go, that health is first and foremost your individual's primary responsibility. So all of them to talk about beds in hospitals and the lack of this and the lack of that. But rightfully, it's about us taking care of ourselves in our natural environment, like getting rid of breeding sites. It's about physical activity. It's about what we eat. And so health promotion is absolutely fundamental to healthcare. And look at any research anywhere in the world, and that will be reinforced and proven. So those who have a problem with visibility will need to accept it because they clearly would not understand that that is absolutely critical to good health care.
All right, Dr. Tufton, I want to thank you so much for being on the show and being so open and frank in your discussion with us.
Thank you, sir. All the best to you. And I like social media, unlike others.
All right, Dr. Tufton, thank you so much. You heard him, dear listeners. He's our Minister of Health, Dr. Christopher Tufton.